Talk to us about supply and demand for nurses in the U.S. What are you seeing?
We're still seeing a strong demand for healthcare hiring. The number of jobs in healthcare are increasing, but it's happening at a lower rate than it was before.
Why?
Most likely changes to the economy and the macroeconomic changes that we're facing as a country. So the other big reason is the Big Beautiful Bill does have Medicare and Medicaid reductions in it, which has slowed a little bit of hiring in healthcare too.
A lot of healthcare jobs, not necessarily RN, but healthcare jobs are occupied in the U.S. by people who were not born in the U.S. I don't know the data that you have on that on your platform, but I'm curious if you're seeing any of the immigration changes that we've seen during the Trump administration, during the first few months of this administration, affect the workforce on your platform.
Yeah, so 20% of healthcare workers in the U.S. were born outside of the U.S., so they do compose an important part of the healthcare workforce that's already here. To be honest, though, we're still with status quo with immigration. I mean, honestly, since 2016, there's just been a huge slowdown in the number of healthcare workers entering the country as immigrants. And a lot of that is just continues with every administration. We saw it with Biden. We're now seeing it with Trump. And so that just highlights the importance of us needing to take care of our domestic healthcare workforce.
So what's the answer in your view? If it's been slowing down at this point for close to 10 years, then what's the right way to approach this?
The best way to approach this is to keep increasing the number of healthcare workers in the U.S. by encouraging more and more Americans to go into healthcare. We also have to remove the bottlenecks in healthcare, including the nursing school shortages, the technician school shortages, and increasing the training programs that are available for Americans too.
Okay, I've talked to some doctors about this, friends of mine, and they give me these numbers that are just mind-bogglingly small. Like some specialties only graduate like 3 or 4 different residents per year in some schools. And like, it's an incredibly small number. So that seems to be structural. But as you move down from actual MDs, is it easier to increase the number? Because it doesn't seem like it's easy to increase the number of doctors in this country with the way the system is structured.
That's exactly right. The way the system is currently structured it is very difficult for us as a country to increase the number of healthcare workers that we desperately need. And healthcare still remains the biggest labor shortage in the country, with the demand continuing to increase from patients getting older, but not enough healthcare workers in the system.
Wait, so cost, lack of places to educate folks, or lack of desire for people to want to do it? I mean, I know folks who are doctors, and I think, Tim, you and I talk about this a lot, who don't necessarily love it. And then there is the demographic side, where I know I've had doctors in my life for years who have recently retired, and yet we're scrambling to find new doctors. What is like the key metric that is, or cost? Like, what is it that is really preventing folks from going into the profession?
It's really just the bottlenecks we have in our system. There is a desire from Americans to become healthcare workers. It's a key way to change, your socioeconomic status. But we have bottlenecks on hiring, on educating, and on training the healthcare workers.
Why do we have bottlenecks if we need them?
Yeah, I think honestly, there's a lot of experiences that we need to continue to improve. That's a lot where Incredible Health comes in. We're actually announcing our AI agents. So what we've done is really ushered in a new era of healthcare hiring that can be done with AI agents to really improve the experience of healthcare workers finding their dream jobs and pursuing their dream careers.
So that's on the hiring side. What about on the actual taking care of patients side and technology there? Is there a way to ease the burden on these healthcare professionals using technology?
Absolutely. Healthcare is one industry that is adopting AI technology very fast, almost as fast as other industries, which is unusual, right, in healthcare. We're seeing AI agents be used at the bedside. We're seeing AI scribes being used. So there are...
We've had experience with... have you had a doctor with a scribe? I've had a doctor with an AI scribe.
I'm not sure if I have.
But apart from that, I mean, and that's really helpful to doctors when they're doing their notes. They probably don't have to spend as much time doing notes, and maybe they can spend more time with patients.
That's right.
But beyond that, is the technology to a place where you can trust it to make decisions that are going to lead to better outcomes for patients?
Yeah, I believe that human connection still matters in healthcare. Both the human connection, the empathy piece. I don't think the jobs are necessarily going to be replaced with AI, but AI is being used to augment and support these healthcare workers who are generally an overworked and burnt out workforce.
Do you see eventually a day, I'm going to just go there, as we continue to see like humanoids and robotics, but a combination of robots with some AI and somehow having a role when it comes to American healthcare?
Absolutely. I mean, we launched 2 AI agents, one named Gail and one named Lind. Gail is a career partner for healthcare workers, a lifelong career partner that helps them generate resumes, that helps them with interview preparation, helps them do mock interviews. And over 90% of nurses give it a thumbs up in terms of giving it, having a great experience, as well as referring it to their friends. And then also Lynn is another AI agent we have, which is a co-pilot for the hiring teams. And so Lynn is now interviewing healthcare workers and is selling them on the organization, discussing multiple jobs with them, and really sharing what's amazing about specific employers.
But what I really mean, just got about 30 seconds, the idea of an actual robot with AI and learning and in a hospital helping out.
I mean, absolutely. I mean, I think the future, that's where we're all headed, not just in healthcare, probably in other industries too.